As discussed in the bipolar diagnosis video, it is important to note the severity of the current manic episode because this will guide your treatment and plan. For example, if the current manic episode is severe or includes psychotic symptoms, dual therapy is indicated. On the other hand, if the patient is in partial remission, monotherapy may be sufficient. Dual therapy includes treatment with either lithium or valproic acid and an antipsychotic, whereas monotherapy includes treatment with either lithium or valproic acid.
Regarding manic episode treatment with lithium, it's generally safe to start patients on the extended release form of lithium at 300 milligrams twice daily. Some other options are listed in this table as well. In any case, it will be important to check a serum lithium level 5 days after initiation of lithium due to its narrow therapeutic index. It's best to check the lithium level about 12 hours after the last dose of lithium to get an accurate serum level. For Mania, goal serum level is around 1 milliequivalent per milliliter, or until symptoms are well controlled. You also want to pay close attention to the patient's other medication regimens. For example, ACE inhibitors and NSAIDs can increase serum lithium concentrations. Lithium may also take 1 to 3 weeks for full effectiveness. After stabilization of mania, you may want to consider switching the patient to once daily dosing to minimize kidney damage from lithium.
Although lithium is an effective treatment for bipolar mania, there are multiple contraindications to this medication as listed in this table. This is another reason it's important to gather a full patient's history and pay attention to any comorbid medical conditions prior to initiating any treatment.
Valproic acid is another FDA-approved medication to treat mania in patients with bipolar disorder. Dosing is typically based on a patient's body weight, and serum monitoring after initiation of treatment is also important here. For mania, goal serum valproic acid level is between 50 to 150 micrograms per milliliter, although some prefer to seek serum concentrations greater than 80 micrograms per milliliter. Also, valproic acid inhibits metabolism of lamotrigine, so if a patient is also taking this medication, the dose of lamotrigine should be reduced by about 50%.
There are different formulations of Depakote, which is valproic acid and sodium valproate, such as delayed release and extended release. This table, created by Dr. Mellon, can be used for reference of dose conversions between the different formulations of Depakote.
This medication table will be available to you for reference later and lists some common antipsychotics that may be used if dual therapy is indicated for a manic episode. Again, make sure to discuss things with your attending physician before ordering any medications for a patient.